Good evening, North Hudson. I'd like to call to order the Village of North Hudson Public Safety Meeting at Thursday, October 9th, 2025 at 5:30 p.m. Roll call, Trustee Porter.
Here.
Trustee Olson.
Here.
And Trustee Keller is also here. Next agenda item would be comments from the floor. Opportunity for the Village of North Hudson residents, property, business owners to make the committee aware of topic issues, opportunities on or not on tonight's agenda. And I believe everybody here is for an agenda item, so looks like we're good on that side. Number 4, minutes approval.
I move to approve the minutes from the public safety meeting from August 7th, 2025.
I second that motion.
All right. Any adjustments or anything? Any discussion on it?
Nope.
All approved, say aye.
Aye.
Approved unanimously. Number 5, we are with Police Chief's report. Chief, you are up.
All right, just a couple of items. 2 months ago now, I think we were talking about the hostile vehicle barriers. They were used during Pepperfest, and they worked out really well. Public Works was very happy with those, and so we returned those to Stillwater PD, and I know there have been a couple other agencies that have been borrowing them for their events just to kind of see how they would work. So at the last Chiefs meeting, at the last County Chiefs meeting, I did discuss with the other chiefs whether or not they'd be interested in going in and kind of doing a group purchase of them. I did send out a survey and got back several agencies that would be interested, many of them for just one event per year. And so we're still in conversations about how that would look if they had a 3-event option. Would they pay, 3 parts of the total, or if we would all pay an equal amount and then be able to use them if other things come up. So we're having those discussions, but based on the cost, of almost $100,000 for the 56 unit trailer, it's obviously a conversation we want to make sure that we all get what we need out of it. So that continues, but just wanted to at least let you know that we're talking about that. That wouldn't be until a 2026 purchase or 2027, because there is one agency that's already has their budget set for 26, so we're still a ways out. Stillwater PD has still opened up the opportunity for us to borrow them as long as they are not using them for one of their events. So if we do need to wait till 2027, Pepperfest 2026 should be okay to be able to utilize them again.
Good.
Under new business, just wanted to bring up a couple of employment anniversaries. Jenny Johnson has passed 11 years as our police department administrative assistant, and Josh Hecht, who's our patrol sergeant, just passed 6 years in September. Both of them September anniversaries. So thanking them for their work, did give them a shout out on the day of their anniversaries and whatnot. But we have some longevity in the department, which is great to see.
Nice.
Yeah.
And then under the incident breakdown, because we didn't have a September meeting, the first 2 pages is the August to September breakdown. Again, nothing out of the ordinary, just kind of the typical call volume. And then the second 2 pages is the September to October call volume, and again, I guess a couple more EMS calls in that time frame than the month before. We've been assisting with those, but beyond that, nothing out of the ordinary. The next item that you have is the written verbal warning citations by officer, and that's up to date through September. I've been trying to get out during the day and do a little bit more traffic enforcement because we had been getting some complaints from citizens about Highway 35 being a racetrack. During the daytime hours as well, so I was out there doing some traffic enforcement as well. And then the last item you have is the overtime expenses all the way through September, and we are on track to be under budget for that particular line item, even though we're short-staffed.
Impressive.
Questions?
Sounds good.
Thank you.
You else have anything?
I don't.
Chief? Okay, going from one chief to another chief. Chief Spielman.
Yeah, enclosed in the packet tonight was the monthly report for September. Nothing to note of any significance. Calls are trending down in the village this year. I believe that's because there hasn't been any major storms to drive up the call volume.
Yeah.
So knock on wood, that won't happen. Fire inspections just about done for the village this year. Our fire inspectors are just about complete, so they should be pretty much done here in the next couple weeks. Nothing major fire inspection wise in the village. And the other thing I will mention is next Tuesday we'll be going down to Madison. Assistant Chief Jeff DeBruzzi, Skinny, was awarded the First Responder of the Year for Assembly District 30 through Chairman Zimmerman's office. So he'll be down in Madison getting his award. We'll be down supporting him on Tuesday next week. So
Nice.
kind of
Awesome.
a
Fantastic.
special thing for him. 46 years with the fire department, 36 as assistant chief. So very well deserving.
Yeah, that's
for the
awesome.
award. So
That's fantastic.
Is this a certain week too? Is it like fire
Prevention Week.
Fire
yeah.
Prevention Week?
Yep.
Yes. Do you guys have anything going on for it, or?
Tons of stuff. Yeah, they've been in the schools every day this week. They'll be in the schools next week. Daycares. It's been nonstop. So yeah.
Awesome. Do they still do those houses? Do we get to go through it, or is that?
We don't have one available to us
Yep.
to do that. They do have a small, like a dollhouse kind of thing to show kids how smoke travels through a house and everything, and they do use that.
I
So
think you should find one of those vehicles. I still am like traumatized by it, I swear. You know, having to climb up
Yep.
and then like through
Yeah.
that little thing, I always like, I still think of that.
The
Yeah.
old school and everybody talks about it.
Yeah,
Yeah.
it was so
Yep.
horrible. I mean, yeah.
Yeah, they have a new version of it.
Oh.
River Falls has one, but
Yeah.
It's not the old one.
I don't know why. It's in my nightmares
No,
still.
I
It totally
remember it.
is.
Yeah.
Yeah.
Anything else for Spielman? Chief Spielman?
Nope, that sounds great. Thanks.
All right. Agenda 7. We would be doing a addition of first responders for emergency response in the village discussion only. And I know we have some people, others that want to discuss it too as well. So who wants to be the first one to start today?
I could go first. We going up there?
Yep.
Yep.
Jay Penfield, Director of the Town of Hudson First Responders. I want to express my appreciation for your interest in this subject and the opportunity. We have no presentation at this time.
Okay. Anybody have questions for Jay?
No, I
On his
don't.
presentation.
Oh, yeah.
Yeah, go ahead, that's fine.
Thank you.
Thank you.
Thank you.
Sure, thanks.
blank you said, huh?
Correct.
All right, try to keep this short. Most of it's on the sheet that I handed out. So last month, or I guess 2 months ago, Chief Richard sent out an email from the village asking for information on providing first responder services for the village, the capabilities, cost of anything involved, stuff like that. So I'll quick run through some of the highlights and just give you some stuff to think about. Maybe, here we go. So right now, we already have an existing relationship with the village. We're under contract for fire protection through 2040. We're a state licensed EMS provider at the EMR level with the state of Wisconsin. And we already respond to high acuity calls within the village, especially cardiac arrest with Lakeview EMS. We're already responding to those automatically, so we are providing some service. Right now on staff, we have 25 licensed first responders. They're licensed through the state. They all receive quarterly EMS training through Regions Health. They come over and do training with us 4 times a year to keep their hours so they can renew their licenses every 3 years. And part of the requirement now for any new members that are hired is they have to become first responders when the class is offered. So it might not be for a couple of years, but part of the requirement to stay in good standing is they have to become a first responder. So we're growing our capability. Our operational structure, so with Hudson Fire providing the service, we have structured oversight. So normally we would have an officer or somebody that acts in that capacity on the call that would oversee the personnel while they're operating. Comprehensive reporting, every incident we go to generates a report, an incident report. So if there was ever an issue or you need to go back and look and see who was there or what happened, you can call, we can generate that report, that can be given. And then regular updates, much like we do every month. Chief's reports here, we can give reports every month on the status of first responders, calls, things like that. Our protocols align with Lakeview, so we are under the same medical oversight from Regions Health. There's a doctor at Regions that oversees our service, make sure that we're up to date and that we have the correct training and coverage and that our people are properly licensed. Insurance, the insurance is carried by the city of Hudson. All of our members, all the firefighters, first responders, are employees of the city of Hudson, which by proxy the contract, are covered. So the city of Hudson carries the liability and workers' compensation policies, which then requires no additional insurance or policies from the village. So I reached out to John Muller, the chief of the EMS for Lakeview, and got some statistics from him. The village averages about 175 EMS calls a year, and I just took 2025 to date. Their average response time for an ambulance into the village is 7 minutes and 57 seconds. So it's pretty good to have an ambulance in town in under 10 minutes. Of those calls to date, to October 1st, 68 were emergent. Lights and sirens, 29 were non-emergent. At this time, as the fire department, we could not absorb responding to every first responder call. That exceeds the ability of our members, being their paid-on-call volunteers. During the day, we can maybe do more, being there's 3 of us on staff during the day, 40-hour work weeks. But we did look at some of the data, and my suggestion would be for us would be to respond to what we consider adult and alcohol level calls, the more serious types of calls. And there's about 50 calls of those a year that would be in that category. And those are cardiac symptoms, strokes, unconscious, seizures, stuff like that. So those are things that we would propose responding to initially instead of every call within the village. And of course, we would review year by year if adjustments need to be made. Our preference would be that our members respond in a department vehicle. This way it identifies them when they arrive. It's not something, it would have red lights on it, it would have markings, it's Hudson Fire. They would be required to come in clothing that identifies them as a first responder, as a firefighter as well. So, not to say that we wouldn't entertain the idea of responding in private vehicles, but I think for the professional image, responding in a department vehicle just makes it better. Mm-hmm. So there would be a cost associated with it, obviously. These numbers are rough numbers. I plugged into our formula that's used for what the village is charged for fire protection every year. So basically, with the contract, the city charges the village 50. You take about 50% of the calls, or take the amount of calls divided by 50. It's a 5-year average, is what they charge for on the next year's budget. So as you can see, it steps out. It goes up, and I just started to plug in numbers. Obviously, if numbers go up or down, these numbers change at the bottom. I have asterisks 2028 and beyond, because I believe those numbers would be less in that regard, because our goal is to have full-time staff by that point in 2028. We wouldn't be charging back for calls when guys are already on duty, right? It would be double dipping or double charging. So that portion would go down, hopefully in 2028 if that goes through. So. Equipment costs and considerations. We maintain all of our medical equipment. Any of our disposable goods are replaced by Lakeview EMS. Any of the future needs are covered within our operating budget. We've budgeted out, we have projected budgets for capital replacements, AEDs, medical equipment, stuff like that. There is new radios that we're all gonna have to be buying. I know Chief's talked about that already, coming up probably in 2029. We're already starting to try to find ways in our budget to start absorbing that cost for radio replacement, so. And funding opportunities, there's grants out there, there's abilities through the state to get money to help offset some of these costs as well, so. So I guess the key benefits of the whole thing is it's seamless integration. We're already providing a service to the village. We're already under contract with the village for fire protection. The professional service, we have oversight, we have full reporting of everything that we do, and our protocol alignment with Lakeview. And I'll entertain any questions.
I have questions. So I need a refresher. It's been a
Same
couple
here.
months, right?
Yeah.
So don't you guys already respond to our calls?
Not all medicals. The only ones where we go to are cardiac arrests, we're
Right.
automatically dispatched, and then at the request of Lakeview.
Like if they can't get to it, then they would.
They would call us, or if they come and there's information that notes that it's a serious call, or they may need a driver to go to the hospital, then they call for us to respond with them.
Okay.
So our currently Lakeview comes here then, that's correct?
Correct, they're your primary medical provider, yes. This would be an augment to assist them more, potentially get here before they get here.
Right. Do we have the numbers from Lakeview? Did we get that ever? Like what their response time or how much we pay them?
I don't believe you pay them anything.
I think it's covered. We did talk about this. They had a huge presentation too.
Yeah.
And there was no cost for
There's no
that.
cost,
They
correct.
go to the.
The patient pays
The
that.
patient
Yeah, they
pays
usually
it.
don't charge the municipalities.
Yeah, it's the patient that is paying it now. I remember.
And this would not replace Lakeview EMS. Lakeview EMS is your primary EMS provider for the village.
And they're
This would be
gonna,
someone to show up in advance or to assist, just like the police department does now, as emergency medical responders, EMR, or what used to be called, or is kind of termed as a first responder.
so if we decided to go, or we wanted to get additional EMS and we had the Hudson Fire Department come out here, it looks like about $82,000 roughly average through the next couple years, it would be
Yeah,
in
because
addition.
that portion of it, I think, go back, that's, you're already paying, again, it's all based on the 5-year average of calls. If your
Right,
call
right.
volume continues to go down, that changes. But for 2026, 65,000 is what's being charged back to the village for calls. Yep. So then if you take that additional 50, you start plugging that additional 50 in,
Oh, I got you.
changes
So
that average.
this is what we're currently paying now.
right here, this is what next year you'll be paying, the
Okay, I got
65,000.
it. So
Yep.
65 is what we're gonna pay for next year, and then if we added this, it'd be,
Yeah,
okay.
yep. Because one of the components is what it would cost potentially to provide the service.
Right,
so.
right.
But with potential grants helping out as well. on
This
certain
one,
items, but that's-
because
Yeah, that's just our
this is
contract.
based on the contract that the village already has with the city for what they have to pay for the fire protection.
Then if we apply it for grants on our own to offset some of the cost or whatnot, if we could get.
Potentially, most of the grants go towards equipment
Equipment.
replacement,
Oh, well, then it's
or
just,
outfitting first responders, yeah. Mhm.
got you.
You know, in your presentation, you talked about if we were to go forward with this, you would recommend probably the Echo and Delta calls?
Correct,
Are those two different type of calls?
correct, yes.
Okay, so
Yeah.
two different tiers, like one probably being the worst.
Yeah, the least dangerous or least, medical need call is what they call an alpha call. It's a very basic needed call, and then it goes to a Bravo call. Charlie, Delta, Echo. Echo, it means they're unconscious, not breathing.
Okay,
And then deltas are your strokes and seizures and difficulty breathing.
and how would that be coordinated? Is it any different than it is today? If we did this?
No, other than we just would have to get a hold of dispatch and change their dispatch
Their
dispatch
protocol or whatever.
recommendations. So when they EMD or when the person calls one, they ask a bunch of questions and then it spits out a letter or
Mm-hmm.
for what type of call it is. We would just have to get added to those type of calls and be automatically dispatched. We already are on automatic dispatch for echo level calls.
So if we did this, I suspect as far as the village goes, it would likely increase our level of service in terms of response call, because we would have, I'm making it sound like a statement, but I'm actually asking a question. I mean, as far as those Delta Echo calls, I mean, serious stuff.
Mm-hmm.
You'd be coming from closer, or is it, I'm trying to understand the,
Yeah, so that's a little bit of a drawback to the way our system operates, is we don't have anybody available, on duty, right? They would have to come from home. Our preferred method is if they go to the station and come on an apparatus, not
Yeah.
saying that we wouldn't have people within the community or within reasonably close drive with a personal vehicle. I just think that route, there's a liability involved with that, if they get in an accident with a personal vehicle or something. But again, that's something we can look at. If that's the way you choose, is to have a further conversation with us, we could look at maybe responding with personal vehicles. It's not our preference or my preference to do it that way. To say we would get here sooner than the ambulance, sometimes yes, sometimes no. But those higher acuity calls that require more manpower to assist with, we would definitely be here to help the ambulance with.
So if I'm looking at this correctly, you said you guys already respond to the Echo, so your recommendation would be to respond to the Delta, just the Delta one sooner, so the ABC, no, and then increase Delta, we think it would go up that much? 20,000, 15 roughly a year, 15? From what we currently pay, you think?
Yes, and this was, I plugged into the formula that we used for fire protection for the contract, and those are the numbers that it gave me when I
Wow.
put it in there. Yeah,
You know, I'm happy to say I've never had to call for emergency service. But like right now, we'll say with Lakeview coming, do they come in their personal car or do they come in an ambulance also?
yeah.
Okay.
They
So-
did the presentation, and this is a
Right.
real think
It was
back.
a while- yeah, I
They have the certain hubs, and if, they could be coming from North St. Paul's, a hub, Stillwater, and I believe River Falls, am I?
Hudson.
Hudson, thank you.
Yep.
Okay.
But if they're out and somebody else has to cover, it could potentially take longer to get here.
So again, Lakeview EMS is an ambulance that is
Right.
coming. So there's 2 paramedics on every ambulance,
No,
just so we
Okay.
keep these separated.
separate, yeah.
Yeah, thank you.
Good at response. We don't tend to wait a long time for them, because we use Lakeview in St. Joe as well.
Yeah, they're under 8 minutes, is the
Yeah.
average
Yeah.
time for
It-
them to get an ambulance in the
It was
village.
not bad,
Right.
yeah.
Those are that's the latest data that John was able to provide me a couple weeks ago.
Mm-hmm.
So, and again, like we do in the city or anywhere, if they're coming from a distance away, they have asked for us to respond before them to get their first and start care. It doesn't happen a lot. They do a great job with their dynamic deployment and moving their resources around.
Right.
But it does happen sometimes where we end up responding for them to get there first. Because there is days everybody's busy, and people do run out of ambulances once in a while.
So you said that we usually have 50 per year of echo level. Is that what you said?
Delta and Echoes.
Delta
Yeah.
and echoes?
Yeah,
And is that City of Hudson and the village or just the village?
just the village.
Okay.
So the village itself averages about 175 medical calls a year within the village. And that's been a pretty consistent number the last 2 or 3 years, the data that I had received. It's 172 one year, 178. I mean, it's a 175 almost consistently. And of those calls I identified, there's about 50 of them that we would respond to if we just did the Delta and Echo calls.
Out of these 50, did we have any issues with something else was going on so you guys couldn't get here right away type situation, or were they all?
We didn't come to all of them, we just
Yep.
came to the Echo level calls. So no, there's nothing that showed me that we had any issues coming.
Okay.
Sweet.
Anything else, everybody?
I don't have any more questions. No, thank you very
Okay.
much.
Just, I have one very general question, if you.
Sure.
Just to kind of get your take on it. The benefit for our village, North Hudson, in doing this, what would be, if somebody came and asked me, well, what's the advantage to doing this? Or what's, not the advantage, what's the benefit, the added benefit? What would, because I'm not sure I'm totally grasping that. Although I like the idea of it.
I think the benefit is the higher acuity, the more serious calls. You get more hands, they're quicker to assist. You can get the patient stabilized quicker, you can get them moved out of the house quicker in the ambulance. A lot of times with those types of calls, Lakeview likes to have an extra person that either drives or gets them back with them to help. A lot of times they call us for a driver. We'll drive into regions for
Okay.
them, stuff like that, so.
Yeah. Thank you for framing that up.
Yep.
That's a big.
And you
that's
guys are interested, if we wanted to do this, you guys would be interested in signing to take on these extra calls?
Yes, I think we could absorb 50
Okay.
more calls a year, yeah.
That was my other question.
And it would take a little time, we'd have to work through dispatch to get everything
Right.
put together. I mean, it wouldn't be tonight, right, but it would be
Well, right,
within
right,
2 or
right.
3 weeks, sure.
Okay, thank you.
Yeah, thanks.
Yeah. Thank you.
Next, chief.
I'm Zach Spates. I'm the fire chief for St. Joe Fire. And I had a little discussion with our town board about this. And I just brought some of the information. A lot of the same information I could give you that Hudson Fire has as well. We respond to all medical calls in St. Joe. And we have the liability insurance. We respond direct to scene in our own vehicles. So we are a little different that way. And hold on, I'll get this set up real quick.
You said you do it in your own vehicles, you said?
We do, yep. And the reason that we've always done personal vehicles is we can respond ahead of Lakeview, and in St. Joe, if we don't do that and they're right across the river, we're gonna be behind them. We're always gonna be showing up after them, so, yeah. Let's see if this works. I gotta press something too.
Did you do anything with it?
I did, I just unplugged it.
All right. No, here it is. Just took a second to read.
All right. So we were talking about, Drew had mentioned some of the calls. This is what I received from John Muller. This shows the last couple of years for EMS calls for the village of North Hudson, roughly that 175 calls a year. If we go to St. Joe, we're roughly the same amount of calls a year. We respond to all level calls, lift assist, all the way up to echo. This kind of shows some of our data from the past few years. We've started to grow in call volume for the fire department and for the first responder department. Our average response has gone up over the past few years from like that 4 to 5 personnel to 5 to 6. And right now we are hovering right at 19 personnel with the potential of going up to 24, and this is first responder only. We have 31 total firefighters and first responders on the department. I just took a couple of spots to figure out time frame for responding from our fire hall. And it's 7 minutes, 5 minutes, 4 to 5 miles. That's really not in play here because our first responders respond direct to scene. We all have medical bags in our vehicles. We have AEDs. I have a slide that kind of explains all the stuff that we have. So we do have 6 personnel that live in North Hudson, so our response time is going to be less than 4 minutes. It's going to be very quick.
Can I ask a question?
Yeah.
I know, it's in the middle of it, I'm sorry.
Yeah, go ahead.
First responder and EMS, aren't they different?
So we call ourselves first responders. We are EMR. We are an EMR department as well.
Okay.
We operate
Same
under
license.
Lakeview regions, the same
Level of license, they
Yep,
all-
the
okay.
same level of license. We are licensed the same as Hudson. We have medical direction under regions. It's all pretty similar.
Okay.
So talking about direct to scene, we do direct to scene just because we are faster going direct versus going to the station and waiting for personnel. We generally run with 3 to 5 personnel to scene, and then we have the remainder go to the station and staff a rescue truck or a utility truck as backup. We started using this because we started seeing 8 to 10 potential people on scene, and we really didn't need them. We do use I Am Responding, which the entire county uses. We use that for personnel accountability because we can track our people. We started using this more for stuff that's out in like Somerset or the state park where we need to be able to see our people. And so we use that for tracking them, but also to know who's going to the scene and who's going to the station. We use our pagers as well. This kind of shows what the personnel is right now. We have 19. We're looking at putting 5 more first responders through class to get their EMR. We do have 6 personnel that live in North Hudson right now. 2 of the people, the 5 potential, are going to be going through EMR class as well. And then we have potentially up to that, once we're done with that class, 21 people that live within 11 minutes of the Malibu Bridge. I was trying to use the furthest response area for us. And amongst our people, we have 3 paramedics, 9 EMTs, 7 EMRs, 5 potential more EMRs, and we have 2 nurses as well. This is what we carry. So we have a medical bag for vitals. We carry a glucometer for additional vitals, oxygen supply. We do have airway devices, C-collar, trauma supplies. For medications, we carry aspirin, glucose, and Narcan. All of our people have traffic vests for accidents, PPE that they carry, and they all have a radio as well, and they all carry an AED. So we do currently have about 20 AEDs on the department because we have each person carry one. So when I initially talked to the town, we talked about doing the entire thing. We talked about doing Alpha to Echo. And so for 175 calls, our board decided that $45,000 for that 175 calls, which roughly is about $257 a call. And if it goes over 175, it would be $300 per call after. And that's it. Let me know if you have any questions.
I don't. I think I got the general questions on that one, so I can understand everything on this one. Thank you.
Yeah, no problem.
Johnny, have anything?
No. Thank you.
Yeah. Pretty good.
I'm David Recker. I was one of your first responders for the last 7 years for North Hudson and the Hudson Township. So responded to, I think, over 1,000 medical calls, and it was usually about 3 to 5 minutes ahead of Lakeview on average, I think, just because I live kind of within the town here, right on the North Hudson Township line there. So I just want to say it was an honor to do that, and it was all free to the township, did not a penny out of you guys' pocket, but I would advocate for a neighborhood-based system, however you do it, like with Hudson Fire were to do it. A lot of their chiefs live close by, and they would respond in their chief's vehicle. So whichever system you go with, having that community-based response is priceless. So, I mean, you can't beat that as far as the response time. And 3 to 5 minutes doesn't sound like a lot of time, but try holding your breath for 3 to 5 minutes. That's all I have.
Okay,
Thank
can I ask a question?
Absolutely.
So, who did you work for? Was it the Village of North Hudson? Were you just a
It
private?
was the Town of Hudson First Responders was our title.
Town of
So,
Hudson,
yep,
okay.
so they had response of it, and they declined to continue the program due to liability issues, or I'm not sure exactly what, but, so then we weren't able to respond to here as well as the township, so.
Okay. And this isn't an either or all things, right, Chief? It's like or could it be? I mean, can St. Joseph work together in this scheme with Hudson, supporting the village, or is that not?
If you want to pay for both services,
Okay, you gotta
I guess
pay for
that might
both.
be an option.
And I
Okay.
think clarify, we don't have to do anything, right?
Correct.
I mean, we can stay as is status quo or add additional,
But I think to your point, the status quo typically was having Hudson First Responders, which was the two, Jay and David. Previously, based on the Town of Hudson First Responder Group, would respond into North Hudson previously. So
Right.
that would have been the status quo. It went away because of the issues with the town board, and so that's why I asked the committee to take a look at this, because it is something that the citizens had been used to in the past. And we don't have 24-hour coverage for law enforcement, which are also first responders in North Hudson, and so there is a gap when all they're getting is an ambulance, and then potentially if they need assistance at this point, they're calling for Hudson Fire for personnel, either for lift assist or for those echo level calls and those kind of things. So, yeah, you're right, you absolutely don't have to, there's no requirement to, it's
Right.
just what service do you want the village to have as far as EMS?
and that was last year it ended, correct? Or is that this year? When did it end?
October 24.
Exactly a year now. We're
Kind
run,
of a hiatus.
okay. Great information, and to remind us, because it has been a little while, sorry. So it's all coming together now, exactly why, right? So we need to do something else, I think. We definitely would, because these guys came to our calls and now we don't have that. So we need to try to find a way to fill the gap. And I think that every resident would want somebody to show up, or, if we don't have all the coverage, and if you guys, Hudson, right, if you guys don't have the coverage, or like you said, it's not always feasible, it's volunteer right now, so there's that gap too.
I can guarantee you we'll have somebody come here.
I think you will.
365.
Yes, but it's
Depends on
how long it would take.
Yeah.
Yeah, nope, totally understand that. I'm not saying you guys are like, North Hudson. No, I didn't mean it that way at all, but, and then St. Joseph, I mean, you guys have a lot of people too for that size.
Yeah, we've increased from, we had 22 members when I took over as chief, and so we've increased to 31. We'll probably be around that 33 to 35 next year.
Wow.
I can tell you that our board was concerned.
Yeah.
Our board is concerned because they kind of flat out asked, they were like, what do we get out of this? And realistically, it was nothing, because we went off of, we were trying to make it so that it didn't cost the town of St. Joseph anything to provide this to North Hudson. And so that's where we were trying to figure that out. But what we get out of it is, what I told them is, our department loves running calls, our people love helping people, and we have all these people that live in North Hudson that wanted to be a part of it. Our board is still concerned that we would spread ourselves too thin, so, you know, that's something that that's why we started recruiting more people and trying to get more, because in the past, we had 12, 14 first responders, now we're looking at 25 next year, so, we want to cover our own, you know, our own area, but, yeah, it is a concern. I think it's a concern for any service that does it.
Right, and especially being that size, all volunteer, and totally understand that. So 45,000 a year and then 300 a call after 175 medical calls, that would just put you guys even?
That's the, it would be,
Approximately.
it would be a single year so that they could determine whether or
Gotcha.
not that was, if that was appropriate or not. Yeah, I mean, it's really difficult to figure that out, because you don't know how many first responders are gonna be available, and we pay all of our first responders to respond. So you could have 2 people, you could have 12
7
people.
sitting there, yeah, got you,
So-
understand. And how many are there of you guys? I don't know what to call you guys now, the volunteer that no longer, the displaced.
We had 4 on our roster, and we hadn't had any funding in, I don't even know how long, I know 5 years we had 0 funding, which meant we couldn't really add anybody on because we couldn't purchase equipment. That was something that I discussed with Lakeview, because they were supposed to be providing that. They didn't have funds for it. The town used to have funding for the first responders before Lakeview took over. The town stated they sent any money they had to Lakeview, and then Lakeview was gonna handle it from there. So we had 4, but that was all based on 0 pay for calls. We provided our own equipment, bought our own radios, AEDs, medical equipment, equipped our vehicles with lights and sirens that
Right.
met the state statutes. All of those things we kind of did on our own. So when it came down to Lakeview's concerns with they wanted us to have more members, it came down to how are we gonna fund that? Because we need to purchase radios and AEDs and equipment, which is where we applied for state grant funding, which we were awarded, which I don't know if they still have that or not. I don't know what happened to that money. And then we were looking to the town for some money to add on to that if they wanted to add members, right?
Right.
And again, that was something when I came here a couple months ago and talked about it, there'd be some cost to purchase equipment to,
Right.
you know.
I was just pulling up the minutes from that,
Yeah.
from that
You
call
know,
too.
and I think the members that would respond should be paid. Like I said, both of these models, they pay their folks to respond to those calls, which, and I know because Zach and I talked, a lot of that cost to the village is to pay the people to respond to the calls, right? To cover the stipend that they get for that. So if we were going to continue this type of operation, there would be some cost for equipment, you know, that type of stuff as well. The reason I didn't have a proposal tonight, and like I said, I discussed it with Zach, and since they had interest in it, and they already have personnel, they have equipment, it wouldn't make a whole lot of sense for us to try to get in the middle of that.
Right.
So that's why we've just decided to kind of wait and see how this plays out. The only difference, between some of these systems and what we would potentially provide would be you guys would have direct control over our organization. We would report directly to you. You would have control over funding. You would have control over operations. You would have a say in all of that. So that would be really the only difference. These guys, it's more of a contract thing, and they're managed under their own system.
Totally understand that.
Do you have a rough estimate of how much the equipment would cost that you would need?
With the current situation with radios, and the only reason I preface that is again, it's something Zach and I talked about, with the systems that might be changing in the future, radio costs are gonna go up substantially. But to outfit with the basic VHF systems that we have now, we were figuring $5,000 or $6,000 a member to add on. That doesn't include stipend pay for members to respond to calls, which I would advocate for. And then it would be a function of how many, what kind of numbers we would want to have. I would shoot for 10 would be my goal in the next year or two.
How many members were there before?
We had 4 when we kind of went on hiatus.
And you'd want to shoot for 10 to just do North Hudson? And you had 4 and you guys were doing much more than North Hudson?
Right, yeah, but that would increase availability. We're only
Right, I
available
totally
when
agree.
we're,
Yeah.
it's just a random,
Got you.
random chance of who's available, and the higher numbers you have available, the more chance there is somebody's going to be available to respond.
David,
And our system also was much like Zach's, where we would respond in personal vehicles, which means your response is much, much quicker than responding to a station, waiting for people, and then responding with a truck. So that was our system as well.
Did you guys respond in street clothes, or did you have something that identified you as a first responder? So the person is like, if I'm lying there dying, I guess I don't care if someone's helping me, but other people would.
Back in the day, we had some vests for the town.
Okay.
That would be something that I would advocate for as
Yeah,
part of that
yeah.
equipment purchase, is some type of identifying material, just
Right.
so, we can identify. However, the system is to where the pager goes off,
You
we're
grab and
standing in the
go.
parking lot after the meeting, the pager goes off, and we go. So
Right. Nope, I
we'd
understand.
have something to identify us in the vehicles, yeah. And our vehicles are all, and Zach is under the same system. Ours are all, we follow the state statutes for emergency vehicles, and we're all, structured underneath that. So the response is much like a police vehicle or a fire vehicle. We follow the same statute that Mark has for his SWAT cars to ensure that we meet the legal statute for that, and we operate much the same as they do.
I have one other question. So you had 4 when this stopped a year ago, and you guys are pursuing, because you are interested in doing this going forward and maybe kicking this back off and having people to do the volunteer. How many do you think you would have if we decided to do this in 2 months? So January, let's say we decided in January.
I'm not sure we're interested in doing it, which is kind of why I stayed out of the way
Oh,
here.
okay.
But
yeah, because
we still have those 4 members. We're still licensed, we still have medical direction. We're 100% ready to go right now with those 4 people. They're all, like I said, they're all licensed and vetted. We have medical direction in place.
You had said that.
We're-
So, not to be totally blunt, if you're not interested, why didn't you pull out or just say, we
I
don't?
kind of thought I did pull out.
Oh, I got you.
I kind of said we don't have a presentation, just because like I said, I didn't want to get in the middle of what
Okay.
these guys
Okay.
have going on, and not that it couldn't be done.
We had something going on.
It's just,
We do
I get you, I understand.
You see what I'm, I
Yeah.
just, it's, I don't know where we stand on it right now, or I don't know where I stand on it personally. I know Dave's, our guys are still interested in doing it, and, but it's just,
Who takes it on and starting it and kicking it off and wanting to go forward to do it?
Yeah, and again, it
I
could be
understand.
easily done. I just don't know that it makes sense with, you know, what options you've got with these guys who have kind of already established some of that initial cost, you know.
Well, I mean, if that's the case, and I know that, you know, Dave, you still want to kind of do it and stuff like that, how come you don't, like, has our been with like Hudson or St. Joe's, like?
Because they're fire department, so I'd have to, I'm already in the
medical.
military and in the National Guard, so
Yep.
that takes up a lot of my time.
Okay,
I got other projects on, so I couldn't dedicate that amount of time to doing fire department as well as the EMS and responding and
okay.
all that stuff.
So these guys just want to do the medical, they don't want to sign on for fire departments, which
Right.
I can totally understand that.
Yeah,
I mean,
yeah. No, I understand too.
There's
Yeah.
nothing wrong with it.
Yeah,
But
right,
yeah, because I was
right.
volunteer
Yeah.
for now, so.
Yeah, I get it. Okay. Thank you.
Yeah,
I get
thanks-
it.
thanks,
I totally
everybody.
get it.
Yeah.
More to think about, I guess.
Yeah, and
Yeah.
thanks for your service.
Yes, 100%.
Thank you. All of you, everybody.
Yeah.
That's
I
it's a
mean,
big deal what you guys do.
I appreciate you guys doing it before, and then what you guys do now as well. I mean, I listen to the scanners, so I mean, I do hear what's going on. I just need to get the call signs down a little bit more, so I know who's what number.
There's a lot of people do because there's apps out there.
Yep.
and
Yeah, they
every
do.
time a big call comes in, you look at the scanner app.
And it grows.
And there's like 80 people listening.
Yep.
Oh, that's funny.
Oh yeah, I have one of those where I can see it go from 20 to 100 on certain times. And I just need to pick up the the call signs, and I'll know who's who. But I do hear St. Joe, and then I do hear Hudson, and I hear our officers too in there as well. So
My daughter, who's 15, loves to listen to it all the time.
Yep.
She'll listen to it. It's weird, but
okay.
good info. Thank you.
Yeah, a lot of great
all.
info. I mean, this is good to know and helps out a lot on what we'd want to.
I think we could do it for like in a short term, but eventually one of these organizations would have to do it because they're just much more
Right.
Yes.
capable.
Yep.
What I'm hearing right now is there's interest, but not a ton of interest, so you guys are out. I mean, we'd have to start up the whole thing,
Yeah, eventually it's
there's,
gonna go to a
Yeah,
higher
so,
organization, and we
yeah.
just have the resources.
It's like
And during our conversation, Jay and I were talking, you know, I told him, I said, even at 19, I feel a little uncomfortable. You know, that's why I want to add people, to be able to respond to it. And it's a numbers game because you have to have those people for the volunteer,
Right.
callbacks.
Yep.
And, yeah, it's out, you never know who you're gonna have available and who's not, so.
Well, and then, I mean, I've had friends on the fire department, or I've gone to a lot of fire events and stuff prior to moving to Wisconsin, and that one fire person has a party, you lose 8 people right there, so, and that's your friends, that's
Yeah.
your gang of people, that's who you hang out with, and it's totally, not saying anything bad about that at all. Everybody's got their life and to live their lives as well, so the number dwindles sometimes as well, so.
Well, Chief Spates, you guys do kind of trickle into the village, don't you, on some calls, or is it?
We auto-aid for structure fires.
Okay,
right now.
structure,
We
yeah.
did more before when there was the bridge that was under construction.
Yep.
And so we did more. And, you know, like I was driving here today and I was like floating like, what, the auto-aid thing, if we could assist with some of that stuff in the future. But that's all up to, I'd have to talk to our board to see if
Okay.
that would be a possibility, because that's something that was definitely on my mind too. But when we start saying that we're gonna respond to a lot of calls, that's the issue. Is because they're concerned about.
No, I hear you. Oh,
Their own area.
yeah. Oh, 100%. I understand.
I think you have to look at you'd be contracting with 2 different services to do different things as well.
I mean,
It's,
we have contract a few right now,
Right.
so
not saying it can't be done, it's just not normally done that way.
yeah.
And on the police side, a strong recommendation that you think that we should pursue something? I mean, being a cop, we don't always have coverage. We don't always have this. What are your thoughts?
Yeah, I mean, the fact that we don't always have 24-hour coverage for the police department, or if we're on a law enforcement call for service, we may not be able to respond to that EMS call, some medical situation. If it's something major, we would break away depending on the situation. But, I think when I think back, being here as long as I have, when we had St. Croix EMS, and they would come with 3 personnel, you know, maybe 1 paramedic, 2 EMTs, or some version of that. And now we have Lakeview EMS, and again, nothing wrong with it, but they only have 2 personnel in their ambulances, and so there's always having a 3rd, 4th body there to be able to run and grab a cot, or to help with getting a stair chair instead of pulling 1 paramedic away from that care of the patient. You know, I think that there's more benefits to having it than there aren't, obviously. But
Oh,
then, of
absolutely.
course,
Yeah.
there's costs that come with that. So that's why I wanted to bring it before the committee and have you look at it and decide if there's value to it and if the money's there. I know that we have a budget meeting Monday to start some conversations on where we're at. So we'll have some conversations today about the police department budget. So whether it's a 2026 option, I don't know. But I just wanted the people that would be providing that service to be able to give you details so that you can make an educated decision.
Yeah.
One way or
So-
the other.
Great.
One totally morbid question. I mean, the calls that we've had in the last year since our number of people who have responded to there, I mean, have more people died, or has there been, you know what I mean, like
I was
a
thinking of that question too,
noticeable
yeah.
difference
Yeah.
in?
And that might be a
care
question for
after-
Lakeview EMS, because I don't know that I could answer that, to be
Okay.
quite honest
Okay.
with you.
I mean,
No, I know.
I'm
I
thinking
thought,
it
I, was,
actually-
I, was, I thought it too.
okay.
Yeah, they would have that.
Yeah.
I don't even know how to ask it, but I can ask it.
Well, that's why I was talking about, you know, we had 50 of the Echo level ones that came in. That's why I was wondering, like, how, yeah, just curious on, like, how many of those.
Quoted echo doesn't mean they were cardiac arrest.
Right.
Just the question could have led it to be that, and then when they get to the person actually might not have been in cardiac arrest.
Right.
You know, so.
Got you. Okay, I honestly think I got all the info and questions I
Yeah.
needed, so it's, if you guys have more.
I don't have anything else. This is actually really, I appreciate everybody coming in, and
Yes.
I'm sorry that we had to delay it a month, but this is great information to let us know exactly what's going on right now.
I
So
agree.
a lot to take in, a lot to think about. I mean, obviously, we currently have the contract with Hudson at the moment, so, and then we have budget coming up too, so we'll have to.
But I
Look
think
at
it
other
full
things.
pictures
Yeah,
brings
full pictures,
everything
yep.
together in all of our minds, and probably the public watching, if they're watching, why we're doing this and possible options.
Well, yeah,
So,
We're thinking about the village. We want to make sure they're getting the best possible service they can get.
right. Okay, thank you guys very much.
Yeah, thank you.
Awesome.
All right. Thanks, everybody, for coming in, by the way. Number 8, the Galahad Road North, permanent prohibited parking on one side, discussion and possible action. Going back into this one, I have been driving down Galahad a lot lately, just to take a look. John, past your place as well.
Yeah.
It's a tough one on what we want to do. I know that those are all new developments on that one side, but I mean, when you're driving down on the east side of everything before, you know, the Badger stuff, I mean, we have all that area where you can park. That's what I was thinking about, like why if we did do a one-sided thing, you'd probably be thinking about doing it on the west side of no parking, and then unfortunately the east side would be parking. But I'm just curious if you've heard any other more insight from the neighbors on that, or?
I'm not talking, specifically the ones that live on the east side, which I think there's like 8.
Yeah.
8 of us. I've only talked to about 3 directly. And the comments were pretty much the same. It's like, well, why? On the west side, they've got big, long driveways. Why, you know, I mean, and I think that and they basically would say the same thing. Well, if they want to make no parking on the west side, make it no parking on the east side, at least where the houses are. Because we've seen my
Yeah.
house. We look out to the road.
Yeah.
And I don't care if somebody parks on the road in front of my house, and I don't think my neighbors do either. And somebody on that side just had a party a while back, but there weren't any signs put up, so I don't know if, I think those signs only go for somebody that's on the west side, if they call it in, or maybe they just didn't call it in. But it's just, we just don't want people pulling off the road into our yard.
Right.
That's, otherwise, I mean, that's just it. And
Because I know Public Works were constantly trying to find funding to, you know, do a Galahad. So eventually, one day, Galahad will be redone, probably have, curb, so you don't have to worry about the, parking on grass and stuff like that situation. But I mean, that's gonna be a while.
Right, and you might find there might even be a lot of West Siders that will fight on that, against that. Because I've met some of them, as well, but, that's 5 years out in the future, so.
Right. No, another thing too about the west side of everybody on Galahad too is just think about the space. Some of those houses or driveways, they're pretty close by each other, so there's not much you can park on those sides. It's a tough one.
Well, yeah, and there's the areas where it's all buckthorn,
Yeah.
but people still don't want people parking in their buckthorn, not just the construction lady. I mean, there's, the gentleman who lives across the street from me, he doesn't like it when people park in his, even though his house is out towards the river and you can't really see it from the
Right.
road. I mean, that's just how it is. So I don't know, what would be the problem with just making it no parking on either side? That
It
would
opens
be-
up everything, if that's the case, but
I mean, people might not, but I'm sure there's people that might not like that, because where are people gonna park? Like I said, the big thing is the big construction trucks, the people that cut people's lawns, there are some of them that actually back into the person's driveway, rather than just park on the
Yeah.
street. In the construction vehicles, I will say, have been pretty good about not pulling off into the people's yards. When they're parking and like when they're putting up all the telephone poles, I think they did a pretty good job with that.
Well, that, you can never get people to not do, those guys can go there and park there, and they can do, they can go even if it says no parking, right? The construction type stuff, they're gonna be able to be on the road. It's the lawn care people and that kind of stuff who would have to find a different place or pull in the driveways, right? So, but if we're city or Excel, those guys, I mean, they're gonna do whatever they gotta do still.
Yeah, they do. They'll come and paint white on your driveway. And it's like,
We just had this talk in Public Works. We have no say on it. We can't stop them. They legally can do it, so we can't stop them. That's just what it is.
yeah, well, there's some people that aren't, will just.
Yeah, I understand, I get it.
yeah. I mean, and
I
I
had a
mean,
guy paint, like, this is beside the point, but like the right white rock we have around our house?
Yeah,
Some guy came along and, painting the red arrows, for electric up the side of the yard, and he literally sprays red. I mean, even though you can see the electrical box and there's, it's like he could have just stopped before the landscaping with an arrow and it was anybody, but it's like, no, you just spray paint. But that's a different issue.
yeah. No, totally agree.
and Chief, the main reason why we're bringing this up again is because we will have well, first off, we need fire and everything to be able to get down Galahad when needed. But also it's because when people have parties or stuff like that, they're kind of blocking up the whole road situation. Was that?
For those that don't call in, like I said, in the past, what we've had is that people that live, and again, to your point, it's mostly the people that live on the west side that, need to have access to their driveway or to the homes, that they have people park on the street, not wanting to have people park on both sides of the street to really make it narrow. They have called and said, hey, we really like the idea of doing no parking on the west side, only having our guests or participants, whatever it may be, park on the east side. It's worked really well. It's just a matter of then we have to go out and sign it every time, and then pick the signs back up every time. And so, again, if you're looking at 6 times a year, it's just a matter of personnel on a Friday and a Monday typically. It was just looking at that if there was a situation where there was a get-together they didn't call, and now we have cars parked on both sides of the street. If we don't have a no parking sign there, we can't enforce the fact that it might be very, very narrow in there, and then a fire truck and ambulance couldn't get through. They may get to that point, have to turn around and find an alternate way, which there are 2 ways to every location on Galahad, whether it's Summer Street North or Wisconsin Street North. It was just kind of one of those things of, again, kind of the point of the other things that we brought forward with the ordinances on, is it something that we can get ahead of? And if it's something that between the citizens or the 3 of you don't want to do, status quo, I think I heard tonight, we'll stay with status quo, and if people call in, we'll help them with getting some signage up to make sure that they feel like emergency vehicles and whatnot could get to their residences for those events.
If it's 6 times a year that this is happening, why couldn't we just have it where you could park along where the Badger storage area is, where there's no houses on that side? So have parking from that whole stretch, And then once we get up to where there's houses on both sides, then we have no parking the rest of the way. So if they need to, they can go park there and then they can walk to whatever party they're doing.
Oh, that's an option as well.
Yeah, and that'd be from, like, say, that Badger storage on the north side.
All the way
Really
down.
just to Summers.
Yeah, so it's a long stretch that they can
Because
park.
very
as
long
Galahad,
stretch.
there is another house on Galahad, that new one that's gone up, but it's pretty far down there, and we walked the dog down there, I've never seen anybody park on the road there. Although I saw somebody parked in front of the, on the ramp going down to the boat launch, parked their trailer vehicle right in front of a no parking sign the other day. And from where I'm with the dog, I could see the one no parking sign and then the one that was behind them. And I just thought, man, because those signs are very visible. But anyway, that's
So
it.
that land right there that we were just talking about, I don't know the name of, who owns that?
Is it Badger Storage? Is that what it is? And plus all the work.
And then all the.
In the car condo
shopyards.
and-
That will
Yeah.
not go to residential. I mean, that's all
It's all in
unless,
this.
That's all commercial.
Yeah, all
So-
commercial.
so, I mean, I'm totally cool with parking on that side directly on, like in front of that,
Yep.
and then doing the rest, no parking.
That's what I would do.
Because we are getting calls from the residents, right? I mean, this is what this is all kicking off, residents and like, worrying about being able to get fire and police there, right? That's what this is all kicked off from.
That's where it started. And when we really started offering it, I can't remember which event it was probably 5 years ago. Actually, I think it was during an election campaign because they were having a candidate, I can't remember which candidate, come in and they were expecting a large, hundreds of people. And so they were trying to figure out to make sure that people were parking right. Because again, they also wanted to leave their driveway open if any of their participants went down or needed medical attention or there was a fire, that they could get them down the driveway, because again, to the point that they have long driveways. And that was, again, it must have been 6 years ago or somewhere around there. And then we said, well, hey, let's kind of put this out there, talk to your neighbors, tell them if they're having events. And then we started getting calls about baby showers and graduation parties and some of those types of things. And it really became kind of well-known that if you live on the west side and you want to make sure that you can get emergency vehicles. So yes, it came from residents, and then at some point, the public works director and I started talking and saying, maybe we should make this more permanent, because then it saves staff time and people calling in and trying to, do return calls. So again, to your point, if it's something where you want a portion of it to be one side only and another portion of it to be no side, neither side, just realize that then when the east side people come in and say, well, I'm having a get together and I want people to be able to park right in front of my house. If the permanent signs are up, we're not gonna then go and say, well, today we're gonna allow parking. We prefer to have it systematic. So if you don't want any signs, great. If you want some signs, great. Just realize we'll enforce them now once they're up, for lack of a better word.
Do you think it's needed? Is this necessary to put up no parking? As police and fire, do you think it's necessary that we go to this, to the extent of saying just no parking on one side or no parking period?
I'm gonna stay neutral.
Good. I really don't care. I don't go down there very often, so this is on you guys. I mean, really, I don't talk to a lot of people complaining about it. I know that we have people that complain about it, and I know that if you drive down there and you're trying to go to the beach down there or, to the boat launch, it does get hairy.
Well, I mean, especially when it gets in the summer. I mean, I know we're trying to put a low parking lot in for Browns Beach, but still, if you have a lot of people there going to the beach on a hot day, people are parking on Galahad. So I mean, except for Browns Beach, you can still be.
They're putting in quite a lot, but anyways, they are putting in
Yeah,
parking, so.
but I mean, you're still looking at
Kind
if
of
we
there.
did that one way.
I think leave it as is now, and if
Yes,
something comes
I'm
up
kind of
more.
on status quo right now, and then if we get more complaints,
Let's
maybe
log them, track them, and
revisit,
figure
yeah.
out what it is. And you know what, if we're getting complaints, ask them what is your, what are your suggestions for this parking? Like, let us know. I mean, I don't care, honestly.
well, it's either status quo or I would go with the no parking on both sides once you come up to the houses.
Yeah, just
on
that.
the east side, west side, and then just have it parking
I think that's
along.
a train wreck for people to keep track of, and then tickets and this and warnings
Yeah, I
and
know, it
everything
could be.
else.
Yeah.
I think that's silly to do. Part of, okay, now know, that's hard to do, I think. But like I said, it doesn't affect me a whole lot, so.
When people are calling in, to do these parking signs? Is it something that we're charging them, or is it just we go and do it?
No, there is no charge.
Okay.
And Chief, would it make sense, obviously, like you mentioned, that one deal where there was a large political event, there's hundreds of people or something like that, we didn't say, but that's one thing, but but I noticed the signs go the entire stretch of North Galahad, and would it be something
No,
maybe a
typically
little
would go,
more reasonable?
typically
like-
would go a couple of blocks, but realize that the 300 block is pretty small, then the 400 block is small, and then 500 block gets larger. So we would typically go out a couple of blocks, because now if you take away one whole side and you put, 10 cars, that's basically the 300 and 400 block, and so typically that's what we would do. But it doesn't go the entire length. We pick wherever the residence is and go 100 block either direction, is historically what we've done.
Okay, it seems like I've seen it a longer stretch than that, but I don't pay that close of attention.
And the signs are spaced fairly far apart. I mean, they're not
Yeah.
every 10 feet, those types of things. But
So
So
why,
to your point, I guess if you decide not to make any change, then no motion needs to move forward and it comes off the agenda. is
well,
what
why
I'm
did it
hearing.
go on the agenda? Where was the kickoff of this exactly again?
When?
Or why? Why? It's because the calls that we receive?
It's calls and then having our staff go out and put up
Right.
signs all the time. So it's taking man hours for them to always go out and put up signs and things like that.
And there was a, if you recall, there was a survey that was done through Public Works.
Yeah.
And then it kind of died on the vine, or it didn't come out of that committee, and so we were just revisiting it as from a public safety perspective. And so it sounds like it will also die on the vine here.
No, what was the outcome of that survey?
It was,
You have a copy of it from a couple of months
it's
ago.
in previous.
Emails? I'm cool with doing one side alone, like no parking, but I hate being the resident that has the parking in front of my house. I would hate it. I absolutely hate it.
Right, and that's where we're coming from. Especially when it's almost always the people on the east side that are having the people, you know what I mean? And then to drive, I honestly don't know. I mean, does that mean people are gonna be parking, pulling into my yard that
Well,
I
they're
don't
going
want?
to. I mean, it's just people parking.
Yeah,
That's
there's-
exactly what it
There's no
is.
curbs and stuff to stop people, so they're gonna be driving
Right.
in people's yards.
Right, and I,
And you're gonna have to pull off more, cause it's a narrow road, so people are gonna go park in grass
Right.
and stuff like that.
right. So,
I think we should status quo right now and pay attention if we have issues again, and then bring it back up maybe later on. But that's kind of my opinion at the moment. And then if we do bring it back up, I strongly suggest that we then do the parking on the industrial side and then go and, no parking past
I'm
that.
cool with that right now. Just, no parking and only parking on the industrial side. But then do you guys, do people get pissed when they have a shower or they have a party? Now where do you park? Where are they gonna park?
But it comes back to it's like 6 times a year. So if they're gonna have a party, like they can walk.
It's more than 6 times a year. That's why we're getting calls, because they're not calling for the parties, right?
Oh, yeah.
So, I don't know. Died on the Vine. How long ago was that survey? Was that when we did the,
We had it back in.
yeah, I've just got 2 years, just Barb, there's been very few times the last 2 years where there's been many cars parked out. In fact, sometimes I think some of the work that the guys had to do, putting up the signs and then taking them down, it wasn't that many people. When we first moved in, though, it was, during the wintertime, there's a big
That's where I
Christmas
can
party
see,
down
yeah.
on one end of the street, but anyway.
can we draft up a little flyer to send to them? Just seriously, it's a block of people. It's not a lot of residents that says, the options are, no parking altogether or parking on both sides. So, let us know. Or, I don't know. I do get it that this side's against this. I don't want them here and I don't want them here. But you don't want them on your road and you're worried about a fire and your house burning down. Should we just do no parking? But then what are you gonna do, right? So now if you do have guests come, they're walking 3 blocks or you're driving your car to shuffle them in. So that's another option,
So you're saying that maybe send out another flyer that says our suggestion of.
If you're gonna have a party, call for this.
Yeah.
like, you have an option. I mean, we can stick with this. If you know you're having a large amount of people at your home, we could do no parking, like you guys have been doing. I do get that it's manpower and it sucks, but we're still keeping it safe so the fire and police can get down there if there's something wrong. I don't know what the right answer is here, but if it's definitely more than 6 times a year that they would be calling if we made this a requirement. How do you make that a requirement? We'd have to build an ordinance for that, I think that's silly. No parking or parking, that's what your options are, honestly.
Let's table it, I feel.
I'm good with that right now.
And then we can bring it back up another day, another future agenda. Good.
I think so. If you have a problem and you want this gone, or if you want no parking, honestly, bring forth your complaints so we know about it. And I know not everyone's watching this, but this is where you're supposed to watch or show up, right? So right now, you didn't show up, we're not here, I haven't heard from you. I've heard from one resident on that road myself. So, put a pin in it, and then we can, if they're gonna address it, if someone wants to address this for real, come in and show us, or maybe I should go back to that survey right now, but
We'll put it in the parking lot. Anything else? All right, number 9, the
budget.
2026 budget discussion and possible action. Chief?
And just to clarify your last statement, that was a callback to Tuesday's meeting. We're not putting in a parking lot. It was a comment that it
Yeah.
basically takes it off the agenda. Just so nobody in
No.
Oh,
Yeah,
yes.
yeah, yeah.
television
I'm just
land
saying,
thinks that
yeah.
now we're putting in a parking lot.
No.
I realize it was tongue in cheek, but
Yep.
Yeah, no,
Because we're
good call
talking
out.
No, it's not
parking.
that. This just,
Yeah.
yeah.
okay, so to the 2026 proposed budget for the police department, if you want to just quick look at I put the sheets on your desktops because these have already been submitted to the administrator, have been put into the entire budget, and that's where the conversation for finance on Monday starts. But just to get you caught up on what my request was, that first sheet that you see, it has the 2025 adopted budget, the 2026 projected year end, and then the 2026 proposed budget. Those in yellow are the wages, benefits, all those types of things. Basically, that's what Nathan takes and does all of his work on, so I don't actually get specific numbers. There's a presumption of a 2% increase, just so that we can kind of show budgetary numbers for wages, and some of the insurance shows a 15% increase, just because that's kind of been the historic uptick. I know that there's a lot of conversation that has to take place with the finance committee about the benefits and those types of things, but coming down to the specific line items, then, just looking at the bottom of the page, if you see the 2025 projected year end shows about a surplus of about $16,000. What I've worked with the administrator and under the current policies that the board has put forward is that we're allowed to move from the approved budget for 2025. We're allowed to move line items within within our departmental budgets without board approval for a number of different things, and actually without administrator approval for other things. If it's more than a $5,000 move, the administrator has to approve it. It doesn't have to go back to the board. If it's under $5,000, it can be a department head that makes those approvals. And so because I have been short-staffed, and I will be short-staffed from June until January, there was about $77,000 of surplus that we, when talking to the administrator, decided that the projected capital would really be better off utilized in 2025 instead of having that go into the unassigned fund and then be spent out of that in 2026 for capital. So there are a number of projects: the replacement of the rifles, replacement of our less lethal shotguns, which are 25 years old, and also our simunitions purchases for a training that we have looked at and moved dollars within that, our current budget. So that's why instead of a $77,000 surplus, we're down to about a 16.8 for being under budget in 2025. Next week, I will come up on my 20th anniversary as the chief of police in this village, and just so you know, never have I gone over budget. So when I project out these numbers, we don't have fluff. You know, we have enough to make it work, and luckily we've had years that we haven't had major cases where we've had to pull a lot of wages or a lot of expenses, but The 2026 proposed then, if you switch to the other sheet, which has police department in blue at the top, that breaks down each of our account, and I don't want to get too into the weeds on it, but
Yeah.
basically, on the right-hand side then shows whether there's been a change. You can see the first 4 items that basically status quo, no change in the amounts that are requested. There's an increase in the other supplies and expenses, which does include a vest and new uniforms for the officer that we will hopefully be hiring and bringing on board in January. We can talk about that in one of the next agenda items. An increase in the dues or subscriptions. Unfortunately, last year, when we did the budgetary process, there was a clerical error that took place, and so when I looked at 2024 budget, the 2025 or 2024 year end and the 2025 projected, the 2024 year end was really low because of that clerical error, and so I just used that number moving forward. So there's a bump for that line item to actually be realistic on what the actual numbers are for 2026 moving forward. There's a decrease in the equipment, office, and computer, because we don't have to replace any of our workstations or laptops this year. So we leave, oftentimes, the administrator says, let's leave $500 in there, just so that if there is an expense, that we have some money in that account. And then equipment protective, because we're doing a lot of the purchasing in 2025 of a lot of that, there is no request there, so a decrease in that line item. Flipping the page over. No change then on the entire backside of the page for those line items.
Right.
And so overall, just showing the increase of that $4,455, which a big chunk of that is the one that had the clerical error, about 4,700 in that. So really, if that 2025 number would have been correct, we would have almost had a 0% increase for 2026. So those are the numbers that were presented to the administrator that will go forward to the finance committee. For those of you that are on the finance committee, you'll hear the exact same conversation on Monday afternoon. But it's we over the years have really been able to lean the budget to those numbers that are needed and have gotten, I don't know if there ever was fluff, but if there ever was, we don't build in a big pillow. We basically know what we need moving forward every year, and the village has done a great job of being, in my opinion, fiscally sound. Questions on the budget?
Congrats on 20 years.
Yeah.
Oh, thanks.
That's awesome.
Yeah, 20 more?
That's funny.
100% no.
So, I think this looks fantastic. This is your final proposal for 26 that you would like us to throw in for approval? Do we have to approve it
No,
to go forward?
and we've had that conversation over the years, that not really, because even if you approve it or recommend approval, the finance committee can do whatever they want with
Right.
it. So it's just more of an education for you all on kind of what the numbers look like, what our costs are, moving forward. But yeah, it's really finance. And then you all as board members have that final decision in
Yeah, and the
November.
end, yeah.
Yeah, when it comes through.
So we don't have to do like a motion to send
No.
it?
No.
Okay.
Looks
Yeah, it looks
fantastic.
really good.
This is a lot of information. You did a wonderful job providing us with all the breakdowns and exactly.
A lot of good information tonight.
There is a lot of info. Okay, thank you for that.
Anything else, guys?
Nope, I'm good.
You again, Chief, Police Department staffing and coverage.
Yeah, so just an update, I have offered a conditional offer of employment to a candidate. The conditions are a medical test, a drug screen, a psychological, and then they have to complete the physical readiness test for the academy, which is a requirement to get into the academy. And so currently the candidate has completed 3 out of the 4. The only thing we're waiting on is the PRT, the physical readiness test. That is scheduled for October 16th at 8 a.m. And so if the candidate completes that, then we'll move forward with a final offer of employment, which would mean, and the candidate has already signed the agreement that if they are hired and sent to the academy, that if they were to fail out of the academy or be removed from the academy, or we remove them from the academy, that all costs associated with the academy would be paid back to the village for that time. And then if they complete the academy, then there's a 2-year agreement that if they leave within a year, there's a certain amount that they would have to pay back to the village if it's voluntary. If the village were to remove them from the position, then obviously there's no cost to them. That was our choice. And then that second year, if they leave, it's a reduced amount. Worked with our HR attorney, did a great job of putting together a nice document that describes all of that. So at this point, we're just waiting for that last test. The candidate is very confident that they will be able to pass that, and then we'll go through. The other piece of that, kind of getting in ahead of things, is in order to get reimbursement from the state for the cost of the academy and a lot of the costs associated with the academy, you have to send somebody to an academy within your technical college district. Unfortunately, well, I don't want to say unfortunately, but in order to send somebody to the Eau Claire CBTC, which is the closest for all of us, we have to get an override because we are in the Northwood Technical College zone district.
Yep.
I've already reached out to Training and Standards and gotten that approval. So we would be able to send the candidate to the Eau Claire Academy if they pass the test and we move forward with that person. So the academy starts in January 5th, would go through middle of May, and then they would be on the road with our officers doing field training starting in May. So
Awesome.
we would hopefully have them on their own by this time next year, hopefully a couple weeks earlier than that, but
Sweet.
we'll see. But that's where our staffing and coverage is. We have had some shortages just because we've been sending some people through training. This is the kind of the time of year where we can get them into those. Officer Lau currently is down in, I believe it's the Waukesha area doing kind of a jujitsu defense and arrest tactics training that he was very interested in, and that's kind of his focus. Gotten good feedback from him so far through the sergeant that things are going well. We sent a couple of officers to a wellness or a peer support conference, which is a big line item right now, and trying to make sure that our officers stay well as they move through a 25-year career and hopefully can come out of it without too much scathing and emotional baggage. So that's been a big push of ours. And then the sergeant, I think it's in 2 weeks, we'll go to a 3-day sergeant supervisor update, and so that'll be good for him to kind of get some of those pieces in. So trying to staff and train as best we can to keep the people that we have, because currently everybody's got at least 5 years on the department, and that's our intent at least through December of 2027, and then whoever takes over at that point can make whatever decisions they want.
I love it. That's awesome. Good.
Perfect.
Thank you.
Any other questions? All right. Police Department capital equipment planning discussion.
At this point, because we made the adjustments in 2025 and 2026, at this point, we don't have much, well, we have 0 capital requests for 2026. The only thing, I did have a meeting today with our representative through the camera system that we utilize, Verkada. There are some new options out there as far as cameras, and so I don't know that it'll be necessarily a police department request, but I'm going to work with the Parks Department or the Parks Board and see if they do have any needs for cameras. I know that Browns Beach originally had some interest, but there was some issues with getting electrical
Yeah.
to the cameras themselves. Well, Verkada has now come out with a camera that's supported by solar power, and so looking at whether or not there's enough solar or enough sunlight in that area because of how the trees are around
Yeah.
Browns Beach. But so it won't necessarily be a police department capital, but we'll be looking with Park Board to see if there's some options for additional coverage just for activities or illegal activities, and if there is a need in any of our parks. And the Verkada rep asked me if I knew of any immediately, and I that's something I'll have to kind of sit on and think about, because most of our parks, if they have any activity, we're lucky. If there's any legal activity, that's even less. So I'm not sure that there is a need, but we'll see if anybody has some interest in it.
Okay. Nice.
Sweet.
Anything else? Anybody have any future agenda items?
Yeah. Could we follow up on the presentations that we had tonight and discuss it, what we think we might want to do, if we do anything, and then if we do want to do something, obviously Finance Committee gets involved.
Yep.
But, to kind of just wrap it up, because I know if it goes a few more months and we don't get back on it,
Yeah.
I'll start forgetting a lot of stuff.
No, I
So,
hear you.
I mean,
Agreed.
But I think it's
I'm
really-
willing, before the next meeting, I'm willing to kind of take the presentations that we had tonight and try to lay them out apples to apples as best we can, or identify those areas between really the two top groups on, just so we have something visual to be able to kind of talk about. For next month.
Yeah, that would be awesome.
Thanks, Chief. You go above and beyond.
Yes. So you need 20 more.
Nope.
Any other agenda items?
I don't think so.
All right. Well, that means that at 6:54 we are adjourned.
Okay.